You've been planning for retirement like a chess master, but there's one piece on the board you might not see coming. That's the $172,500 healthcare bill that awaits you in retirement. Now, let's be specific about what this number really means, because it's bigger than most people even realize. According to Fidelity's 2025 study, if you retire at 65 this year, you can expect to spend $172,500 on healthcare and medical expenses throughout your retirement. Now, that's not per year. That's the total amount over your lifetime. But here's what can make it feel overwhelming. That breaks down to about $719 every single month for healthcare costs. And that estimate assumes you're enrolled in Medicare, Parts A, B, and D. So we're not talking about people with coverage. We're talking about the monthly costs on top of that. If you're like most people that I talk to, you've done everything right, saved for decades, build up a solid nest egg, and you feel somewhat confident about retirement. Then someone mentions healthcare costs and you think, wait, doesn't Medicare cover everything? That's the moment when retirement planning gets real. Here's what that $172,500 figure actually includes. Okay. Medicare premiums. Yes. Medicare is not free. Deductibles and co-payments for medical care itself. Prescription drug costs, not fully covered. Over-the-counter medications. Dental and vision care. Medicare doesn't cover these. Medical equipment and supplies. So what it doesn't include is also long-term care costs. So if you need nursing home care or extended health care, that's additional. Here's the part that might catch you off guard. Medicare typically covers about 60% of your total health care costs. That's about 40%. Where does it come from? Your pocket. From the retirement savings you work so hard to build. You've probably been planning for your lifestyle, travel, hobbies, maybe helping the grandkids. But staying healthy is part of your lifestyle as well. And most of us focus on saving enough to maintain our lifestyle without factoring in these monthly health care costs. Think about it this way. Imagine your mortgage payment never ending, except this one starts when your paycheck stops. The good news? Once you know about this gap, you can at least plan for this, just like you've been planning everything else. Now, these strategies make all the difference. First, Medicare supplement insurance to fill those coverage gaps. These can help cover what original Medicare doesn't, like deductibles and co-payments, for example. Next, HSA or health savings accounts. If you're still working, these give you triple tax advantages for medical expenses. Contributions are tax deductible. Growth, tax-free. And withdrawals for medical expenses are also tax-free. Third, building a realistic monthly healthcare budget into your retirement income plan. That $719 month average needs to be factored into your retirement cash flow. Just like housing and utilities, you don't need to panic or completely rework your retirement. You just need to account for reality instead of assumptions. You're already proven you're the type of person who plans ahead. You've been saving consistently, thinking about your future. The healthcare piece is just another part of that same smart planning. The bottom line, the same discipline that got you to max out your 401k and help you handle your healthcare planning too. You just need to know what you're planning for. If you want to make sure your retirement savings cover your actual retirement life, including the healthcare reality, let's run your specific numbers, because the planning you've already done deserves to account for the full picture, not just part of it.